Welcome to The Explainer. Okay, if you're a medical trainee, you know that one of the questions you're going to get asked all the time is about weight loss. Today, we're going to build a clear, evidence-based framework for counseling your patients that you can start using right away.
So let's jump right in. This question comes up constantly in the clinic, right? And just saying eat less, move more, well, it just doesn't cut it anymore. We need a much more sophisticated, evidence-based way to guide this really important conversation.
You know, when you look at the research, it's pretty clear that successful weight management really boils down to three things: diet, exercise, and behavioral therapy. All of them are super important, but for this explainer, we're really going to zero in on the one you probably counsel on the most: dietary therapy. All right, so here's our game plan. We'll talk about setting realistic goals, what I call the first 5%. Then we'll cover some universal rules that apply to pretty much everyone. After that, we'll do a quick tour of the different diet archetypes, talk about the single biggest factor for success, and wrap up with the really tough part: mastering weight maintenance.
Okay, so first things first. When you're starting this conversation with a patient, you have to set some clear, medically significant goals. And we're not just talking about a number on a scale here. We're talking about real, tangible health benefits that are actually going to motivate someone for the long haul.
So, where do you start? Right here. A pretty modest weight loss, just 5 to 7%, is unbelievably powerful. I mean, the landmark diabetes prevention program showed that this exact amount of weight loss slashed the progression to type 2 diabetes by a staggering 58% for people at high risk. That is a life-changing result from what feels like a really manageable first step.
Okay, so that's the first goal. Now, what if you have patients with cardiovascular risk factors? Well, then we can aim a little higher. While that 5% is a fantastic start, the big look-ahead trial found that losing over 10% of body weight actually led to a significant drop in the risk of major cardiovascular events. So this gives us a really clear, evidence-based second target to shoot for. So the big question is, how do we actually get there? Well, the basic math behind it really helps make these goals feel less intimidating. A daily energy deficit of around 500 calories, that usually works out to about 1 pound of weight loss a week. That kind of predictable, steady progress can be a huge motivator for patients. All right, so before your patient even starts thinking about which specific brand of diet they want to try, there are these foundational principles that honestly apply to everyone. Just focusing on these simple rules can lead to some pretty amazing progress all on its own. And here they are. The power here is really in how simple this is. Just think about it. What's the impact of just these 5 steps? Getting rid of sugary drinks, cutting back on processed foods, getting a handle on portions, tracking what you eat, and, this is a big one, shifting your mindset to a long-term approach. This is the bedrock that makes any specific diet plan actually work. Okay, so once that foundation is solid, then we can start looking at the different diet archetypes. And the key here is to think of these not as some kind of competing ideologies, but more like different tools in your clinical toolbox. Your job is to help your patient figure out which tool is the right fit for them. All right, let's look at the two heavyweights: low carb and low fat. You know, low carb diets, they often give you that faster initial weight loss. Now, a lot of that is water weight, but hey, that can be super motivating for patients starting out. Low fat diets, on the other hand, they go after the most calorie-dense nutrient we eat. But the really important counseling point for both of these is all about quality. You have to emphasize healthy fats and proteins in a low carb approach and really push for those high fiber whole food carbs if they go the low fat route. But your toolkit doesn't stop there. We've got other really solid evidence-based options. You've got the Mediterranean and DASH diets. Both have been studied to death and have huge health benefits. High-protein diets are great because they really help with feeling full. And then you have intermittent fasting, which is all about when you eat, not just what you eat. But here's the crucial thing to remember. They all work by creating a calorie deficit. The specific method is just the vehicle to get to that same destination. So, you've laid out all these options, and then your patient is inevitably going to ask you the million-dollar question. And honestly, what we're about to cover next is probably the most important part of your entire counseling session. And there it is. So doc, which diet is the best? Every single patient wants to know the secret sauce, right? The one best diet. Well, after decades of research, and dozens of randomized controlled trials, they've all pointed to one clear and maybe kind of surprising answer. This is it. This quote is the single most important takeaway from this entire explainer. The best diet? It isn't low carb, it's not low fat, it's not any specific brand. It's the one your patient can actually stick with. Period. Over the long haul, being able to adhere to the plan blows macronutrient composition out of the water every single time. And once you really get that, it changes the entire conversation. You see, that one insight totally transforms your role in the clinic. You're no longer the expert just handing down a prescription for a diet. You become a collaborative partner. Your goal shifts to shared decision-making, helping your patient find a path that's sustainable, maybe even enjoyable, and that actually fits their life, their preferences, and their culture. Getting your patient to their goal weight, that's a massive victory. But, and this is a big but, it's only half the battle. Now you have to prepare them for what is honestly the toughest phase of all, weight maintenance. This is where their own biology starts to fight back. Okay, this concept right here is absolutely critical to explain to your patients. It's called metabolic adaptation. Basically, as they lose weight, their metabolism slows down. But here's the kicker. It slows down more than you'd expect just from them being a smaller person. What this means in practice is that they can't just go back to their old eating habits, even with smaller portions, or they'll regain the weight. Their new normal for maintenance calories is just lower than it used to be. And if that wasn't enough, look at this. It's like there's a hormonal conspiracy working against them. Ghrelin, that's the I'm hungry hormone, it goes up. And at the exact same time, all the hormones that make you feel full and satisfied, leptin, peptide YY, you name it, they all go down. And these changes can stick around for over a year, creating this powerful biological pull to regain every single pound they lost. So, what this all means is that maintenance isn't passive. It requires a really proactive counter strategy. You've got to stress the importance of physical activity, not just for burning calories, but to help fight that drop in metabolic rate. Pushing for a higher protein intake can also help them feel fuller and battle that hormonal drive to eat. And you guessed it, you have to keep reinforcing all those behavioral skills for the long term. So, when you put it all together, this framework really shows that your role isn't just to find some magic diet for your patient. It's to be their long-term guide. By setting realistic goals, teaching those universal principles, truly embracing shared decision-making, and preparing them for the biology of maintenance, that's how you empower them to achieve something way more important than just weight loss. You help them achieve lasting health.